Today, there's a heightened call for collaboration among service providers and others at the community level. Rising need, limited resources, and attempts to improve outcomes all contribute to the changing landscape. Factors such as these are challenging service providers to rethink how and with whom they function, and to determine if by partnering with others, they can meet more of the need in a more effective way. Community partnerships, including those involving faith-based organizations, are an important part of improving outcomes and better leveraging community resources. Highlighted in this video are the following groups: Birmingham Recovery Network, Families Moving Forward, New York Recovery Community Coalition, Northern California Care Coalition, One Purpose, One Voice, and lastly, We Connect DC Metro Collaborative. The intent of this video is to help communities understand the basic considerations necessary for successful community partnerships among faith and other community-based organizations. Although the video devotes significant discussion to partnerships between faith and secular organizations, the information shared can be helpful in developing or enhancing any community partnership collaborative.
People in recovery have seen the floor or the rug, the proverbial rug, pulled out from under them. We had an economic collapse in this country, the likes of which hadn't been seen for a long time. It affected foundation funding, has severely affected government funding and government portfolios. And in addition to that, healthcare reform has passed, and we find that many of the providers in our community, particularly those folks who've been around for a long time, know the community well, know the families well, they've not really been able to adapt. And so we find that many treatment centers and many providers are closing down, going out of business, and we're hearing that news from around the country.
One of the things that we are beginning to realize is if we move beyond our silos, we truly can address issues of poverty and education. We can share resources and contacts, and most importantly, we can share the heart of what we believe in, which is supporting young people living in healthy, supportive environments and striving to be all that they can be.
How do we move forward when the resources are dwindling and the problem is rising? We have to stand up and be accountable to the community. The government is only going to bring us so far, but we still have resources among ourselves. I know how to work by faith. I know how to go out and ask somebody for some resources. Sometimes we get and sometimes we don't. Other times I connect with others who have resources and they're willing to share. If we just stop stockpiling and put resources back in our community, we should be able to do some things.
Being from the faith-based background and being an ordained minister myself, the greatest benefit that we see in partnerships and coalitions and in networks is I have a great understanding that no man is an island, and we will always be stronger together than we will ever be separately.
One of SAMHSA's underlying reasons for convening the 2010 summit was the realization that behavioral health issues will not be solved at the federal level. Meaningful progress must stem from local efforts, supported by government, but spearheaded by people in communities. However, an essential question needed answering: what is community? Defining community is a critical initial step in the planning process for any local collaborative. Selecting the target community sets the stage for identifying potential stakeholders, the information to be collected, the problems to be addressed, and a range of other important planning points. A community partnership is only as strong as the group of people or organizations that come together as a part of it. Members are the lifeblood of the entity. Because of that, the topic of membership deserves time and attention.
It's going to be very, very important for us to strategically think about who we're bringing to the table. For sustainability, for inclusion, making sure we have the consumers, making sure that we have diversity in age, making sure that we have the cultural competency, and all of those pieces will all be a part of making a coalition sustainable over time.
We're learning that veterans need to be at the table, seniors need to be at the table, not just youth. We want to bring law enforcement and doctors and others in so that we have a wider voice.
I believe that was SAMHSA's intent from the beginning, because the clients that we serve cross all of those sectors. They are involved in the faith-based community. They may be involved in the substance abuse and mental health arenas. They often come in with housing needs. Definitely people need food to eat every day. So having a wide array of providers participating in the collaborative has been really beneficial, and we've been able to establish some working relationships already where we can share resources with the clients that we're seeing.
There's a saying that when I run fast, but when we run far. That is the greatest benefit for us here at the Foundry. Being a part of a coalition with other faith-based and non-faith-based or secular organizations is that we just know that together, pulling our resources together, pulling our spirits and our attitudes together, we will do so much greater than we would ever be able to do separately or alone.
Not all partnerships are structured in the same way, and a group structure may change as it matures. At the start, though, SAMHSA encouraged teams to define some level of structure. Though resolving such issues requires an initial investment of effort, the group's ability to function smoothly thereafter is greatly improved.
The first thing that we knew we had to develop was some kind of structure for the network. The Birmingham Recovery Network was just a loose fitting of individuals. So we had to sit down and say, for the first 3 months, we need to figure out what our mission is, what our vision is. And then after that, we could figure out how can we make those reality through goals and objectives.
Coalition building is about relationship building. So getting to know each other, getting to know each other's organizations, getting to know the strengths and the weaknesses takes time.
We actually have 4 areas that are now part of our steering committee. And on that steering committee are representatives from each borough who come to help the coalition form its mission, get its vision together, and try to decide what areas we want to move into.
We wanted to just focus on Southeast Louisiana. We didn't want to go to Central. We didn't want to go to North Louisiana. What's going on in these communities? We had Hammond, Louisiana, Baton Rouge, Louisiana, and New Orleans, Louisiana. And it didn't matter where the geographics were, the problems were the same.
We have a very large community with very diverse needs. We have the largest ethnic diversity. I think 180 languages are spoken in LAUSD schools. So probably next to New York, we have the largest global representation of youth in our community.
Is really connecting resources together to better serve people who we interact with. Over a year ago, when the coalition didn't exist, I did not know that various groups that are now in the coalition existed, and if I did know they existed, didn't know the services that they offered adequately enough to refer clients to and to even build more of a support for our staff that serves people. So that's been a huge help and a great example of how the coalition has been able to work.
We have city, county government agencies and state agencies involved and willing to participate, which I've not seen before. I mean, you see them in pieces and parts, and it's usually around a grant. But this one is, I don't know why I'm here, but I'm here because I believe in the process and I trust the leadership.
Oftentimes, particularly when we're working with publicly funded programs, they have a set agenda. And so you're generally taking a set agenda to folks and saying, here's what we want to do. And this is what you have to do in response to what we want. And I think what we were able to do with the coalition is to actually go to providers and say, what is it that you do that you're really good at, and how does it fit in this equation? And so we kind of did a reverse system approach and much more provider-oriented and specific to what their needs were.
We've got conventional treatment on one side of the street. We've got faith-based on the other side of the street. They're each doing their own thing, and neither one of them are getting the 80 or 90% success that we would like to get. I mean, 60% success is great, but if we can get 90 or 95 by bringing the models together and coming up with something brand new that'll work in a different way, that would be even better.
And when you have excitement and energy, more people are going to keep coming because they believe that something's actually going to get done, and they have a role in that to get it done.